Department of Urology, the St. Antonius Hospital is one of the largest departments in Germany. We have patients from all over the world. We are covering all fields of urology with a subspecialized urologist, so there's almost no field where we cannot offer the patient the best possible treatment. We are very good equipped. We have 3 robots here at St. Antonius Hospital. We have HIFU therapy for focal treatment. We are doing MRI-based fusion biopsies.
We are using fusion biopsy now since 2.5 years. We are doing it as a routine procedure and have done more than 180 cases. We find around about 80% of cancer in our patients, so that means we have a very high proof of prostate cancer, and especially for these patients who have a high-risk cancer. That means an early diagnosis, and this improves, of course, the prognosis of the patient. Fusion biopsy is at the moment the best technique available, but we are still developing it and improving it.
We perform robotic-assisted partial nephrectomies on a regular basis for patients with kidney tumors. Whenever a kidney tumor that looks feasible to really resect just the tumor, we try to use the robotic approach, which is a minimally invasive technique. So we can try to spare kidneys and not take them out completely, but only resect the malign part of the kidney. We usually just use small incisions, and infection rates are low, so patients really benefit. They can come home very early, they have less pain, they have less blood loss.
The evidence is rising that the robot as a tool, if it is used in a specialized center, you have better results, especially for the functional results, continence and potency.
In our training center, the European Robotic Institute here at St. Antonius Hospital Gronau, we have facilities that enable us to not train in the patients, but to train beforehand, virtually in a virtual environment and also in a dry lab, which means we can try to get the learning curve, which is there for every procedure, out of the patient care into a non-patient environment. We're the only training center of that kind in Germany, Austria and Switzerland, which is really focused on robotic surgery. Here at the European Robotic Institute, we can offer external doctors training in procedures to get faster, quicker and more safe in the procedures.
The HIFU Focal One is a further development of the Ablapterm device. We perform the HIFU Focal One almost at patients who have contraindications to surgery or after surgery if they have a local recurrence or after radiation therapy failure. The HIFU treatment is a less invasive therapy and it seems to have less complications.
We have a special research center, and with the data of more than 7,000 radical prostatectomies with a long follow-up, we have several people doing research in that field, especially in a prospective as well as in a retrospective way. With our expertise, we can offer the best care. We have a special process management.
Before the patients come for an appointment, this process managers organize all the medical data and prepare all things so that they can be ready for a surgery. The process manager accompanies the patients, starting with the check-in till the moment they have their surgery here. The patients benefit from a fantastic, strong team acting in the background so that the patient has nothing to do than to concentrate on his own recovery.
The care in the hospital here was marvelous. The days I was here, I only experienced professionalism and the deeply convinced care they gave me. The advices, how to continue, how to go on. So I'm very happy that I choose Dr. Witt and his team.
The future of the urology department in the St. Antonius Hospital is looking more on quality issues. How can we do better? Checking all our processes and checking our data. The goal is to have better care results for our patients, and there's still possibilities to improve.